Okay, we will plan the mandible for this patient now. Resorbed mandible. The mental foramen is closer to the ridge on both sides. So placing implant in the molar may be challenging. So in this kind of situation, there are two options are available. Either you stick with all on four, or you try to place one molar implant. No, three options are there. One is placing a short implant, or place a lingual cortical engagement, or get buccal cortical engagement, or towards the buccal direction. These are the few options available in this kind of severe resorption cases. The key implant is the tilted implant, distal tilted. Okay, so basics of planning. This is second premolar, I guess, right? So the second premolar is exactly, second premolar is exactly above the mental foramen. So how much, where is the crest above the mental foramen? This is one parameter. And what is the distance between this mental nerve and the lingual wall? How much good bone is there in between? What is the width here? That is the key thing. If there is good width is there, then it is a easy situation. So a mild, even if you place the implant straight in the mental foramen area, the loop, the mental nerve won't get damaged. So tilting here, it becomes very easy. So the golden rule is the distal tilted implant should be of minimum 3.7 or millimeter diameter or above, if you are not placing molar implant. If you are placing molar implant, this distal tilted can be 3.5 also. So this is axial implant is straightforward. The lingual, this wall is our guidance for drilling. Stay parallel. It is around 10 to 12 mm implant. If you select more than 12 mm implant, the implant may not go into this cortical bone and it will spin. So one reason for implant spinning lower anterior is not recognizing this cortical wall, this bone, and try to not to perforate this cortical bone and perforate lingually. Highly dangerous, not needed. So here 3.7, 10 or 12 mm implant is enough. Left axial is also, left axial is quite very smaller in length. As I already told, follow the lingual wall, it will give you the correct prosthetic position like this. You can place the implant like this also, but the abutment comes too much lingually, interfering with the tongue. So the trick is to place the implant along the lingual wall, parallel to the long. Here the bone is little cortical, you may need to use good drills. 8 mm implant is more than enough. Don't try to place more than 8 or 10 is more than enough. Very small diameter implant is enough because the bone is cortical. The other key implant is distal tilted implant. First place axial just in the mental foramen area and analyze the anatomy. Where is the mental foramen? So this is canine, I guess. Yeah, this is canine. By looking the, no, not canine, first premolar maybe. Here the mental foramen is little far away, I guess, little distal, which is good for us. Okay, so this is the view we need. Above the mental foramen, the crest is very closer. Okay, here the distance itself is 5 mm. So if you put a 4 mm implant here, of course tilted, very close to the now. So what we can do is, So do not start above the mental foramen, start in front of the mental foramen, and you can tilt, angulate mesially. Okay. 12 mm or 13 mm implant will be enough. 3.7. We will see the 3D. Okay, here if you see here, the loop is closer, right? Loop is closer and it is coming. So left side may be little challenging. We will start the implant little more anterior. Maybe this is the first premolar. Just distal to the first premolar we will start. This is the second premolar, and tilt mesially. Now it must be safer. It is quite safe. Okay. So what we did is just distal to the standing tooth. We will start the implant. Stay close to the lingual wall because the mental foramen is mostly on the buccal aspect, and tilt as much as mesially. Now what we'll do is we'll do like this and we'll check. So it is quite safer. Okay, now we will check the possibility for placing a short implant in molar. The length is very small, right? So it is around 6 mm only. So it is not very much ideal. The situation is not ideal for placing implant in the molars on the left side. Right side it is there. So right side you can place a 10 mm implant very smoothly. Very minimal drilling. The bone is osteoporotic. Only the crestal bone is cortical. Do not submerge the implant. If you submerge the implant, it will slip into the marrow bone and you may lose the implant. So keep the implant equicrestal. Place a 4 mm implant. So you will get a maximum stability by the width, engaging the crestal cortical bone. Very minimal drilling, pilot drilling and 2 mm drilling, that is more than enough. So this 5 implant is more than enough. So in provisional you avoid the molar. In durable you can give the molar on the left side. Right side you can give. Soft diet. The highest risk factor for this patient is this bone, which tells the patient is a heavy chewer. Only when the masseter muscle is in a chronic heavy activity, this bone adapts to handle the stresses. Okay, so that is the only thing we have to take care of.